This guy told me he had pink eye. He had metal shards in his eye from welding. Oh my God, can that happen? Hey guys, Dr. Mike here. Welcome to the third episode of responding to Reddit threads. This week's response video is gonna be to the thread titled Doctors of Reddit. What's your thank God they came in for a second opinion moment? I know mine. Are you ready for me to tell you? I'm working in an urgent care, and the last patient on my schedule happened to be part of a family, and when I walk into the room, they're covered in bruises. They looked horrible, like in horrible condition. It almost looked like they belong in a level 1 trauma center. I asked what happened. They told me they were coming back from a road trip. Unfortunately, they got into a car accident driving like 70 miles an hour. They were treated, let go, but they were still having so many symptoms that they wanted to come see me. My first question was, give me your records. Show me what tests were done in this place where you were treated. They give them to me. I look and it's like, okay, scan 1, scan 2, scan 3, labs, this, that, everything looks decent. Where is the scan of the head to make sure you're not bleeding inside your brain? And they're like, oh, they told us we shouldn't do it, that we didn't need it. And I'm thinking to myself, that's crazy. Not only is one of the family members on blood thinning medication, but they were involved in a 70-mile-an-hour car accident. So despite the fact that it was very difficult to get them to the ER for the second time that day, I made it happen. We got them there, and what do you know? They were scanned. One of the family members bleeding into the brain, ended up staying in the neuro ICU, and is affected to this day. Had they gone home, not seen me, went to sleep, the outcomes would have been much worse. So that's my thank God for a second opinion moment. Now it's time for me to read and react to yours. Well, not yours, but Redditors. Are people on Reddit? Oh, sorry. My dad went to the same ear doctor for around 9 years due to poor hearing and was told there was nothing wrong. When he finally went to a second doctor, they referred him to the hospital and found tumors in his ears that had eaten entirely through his inner ear bones and eardrums. He needed 4 operations to remove them, 1 every 6 months. If the second doctor hadn't offered their opinion, he probably would have had tumors eating through the back of his skull into his brain. Well, I don't know if that's true, but the fact that you're going to see a doctor for 9 years and you have a loss of hearing and they're telling you everything's fine, that's wrong. You have a symptom. If they're not curing the symptom or addressing the symptom or explaining why the symptom is there, they're not doing their job. Are you yawning during my Reddit thread? That's so rude. ER nurse here had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. Yo, that's crazy. That's like in medical school when we're all listening to each other's hearts practicing, and then we find out someone has like a serious heart condition. That's crazy. I had a doctor in high school who was unconcerned when I suddenly developed vertical double vision, which was freaking out everyone in their emergency room where I had gone initially and had lost 60 pounds for no reason. That's an insane amount of weight loss. It was only a year or 2 later when I told him that my arm would fall asleep much faster than normal when I raised to ask it a question in class that he thought there might be something wrong with me. MRI ordered, brain tumor found. Bear, isn't that crazy? Bear doesn't sound concerned. That's a crazy story to me because the first question you ask, even if you're remotely concerned about a cancer history, is, do you have any weight loss? Unintended weight loss specifically. And when they say yes, that encourages me to start scanning and looking for things that I normally don't check for. Having a 60-pound weight loss should automatically be a red flag. Raising your hand and having it fall asleep on you, not a huge red flag. That could be simply an issue with cervical radiculopathy, which means that like your vertebrae, where the nerves come out in between your vertebrae, can get impinged and cause symptoms that shoot down the nerve or cause it to get, for you to develop some numbness or tingling. 60-pound weight loss? That's major disease unless proven otherwise. And I think Bear agrees. Dermatologist here. I have seen probably 5 instances of my other doctor told me was fine that were melanomas. A lot of times people don't want full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. Yes, there's so many patients of mine that I recommend that we do full skin exam or maybe even offer them a referral to the dermatologist, and they pass up on it. Melanoma is one of those cancers that's growing in diagnoses, and it's one that can be incredibly dangerous because it spreads when it metastasizes to really weird areas of the body, like the eye, bone. Like these are problems that you just want to avoid with careful screening. Psychiatrist here. A 30-year-old man with mild depressive symptoms was in and out of the hospital fairly quickly. He was under pressure from his home life, living with 4 roommates who were making life a bit difficult for him. No suicidal thoughts. He was cleared of all psychopathologies by me and 2 other doctors. A few months later, he came back, same symptoms. However, this time he talked about 5 roommates. It felt wrong, and I digged into his story, tried to contact his roommates. He lived alone and was severely psychotic. I have no idea to this day how he hid it so well from everyone. When we scan for psychosis, we look for inconsistencies between the patient's subjective experience of thinking, being, and acting, and the objective reality accepted by the general cultural norm. This patient managed to live in a subjective psychotic world that just fits so well with the objective reality that he tricked several psychiatrists, including myself. In this day and age, it's very easy for that to happen. We want to be as understanding and open and not judgmental as possible. However, if you're trying to establish whether a patient is basing their current situation in reality, sometimes you have to ask probing questions. But now there's an art to this. You can ask questions by making yourself seem very curious as opposed to inquisitive, as if like you're a detective. That little change in tone can go a long way, especially with a patient who may be psychotic or psychologically ill. An elderly gentleman was brought in by his concerned adult children for chest pain. He wanted to believe his primary doctor that it was just some gas or heartburn, but his son just had a gut feeling and made him go to the ER with everyone so he can get checked out. Heart attack was imminent, like we weren't sure if treatment would take effect in time to prevent it. Declared code blue, means heart stopped. All hands on deck. Place went from a very quiet, empty ER to sheer chaos in minutes. There's no doubt in my mind that this gut feeling saved his life. Wow. Knowing your own body and being a good advocate for yourself, or having a family member that knows you well and is a good advocate for you, is crucial in getting better health outcomes. That's why those who don't have an extended family or are not married generally have worse health outcomes because they don't have someone to advocate on their behalf. I got a moderate traumatic brain injury in October, and the week after I got home from the hospital, I wasn't acting like myself, was refusing to eat, and just didn't make much sense. My mom called the doctor a few times. They said it was normal, but to take me in if anything changed. She took me in on Saturday a week later because I started slurring my speech and was unsteady on my feet. The injury caused my sodium levels to drop from 140 to 119. That's quite dangerous. This in turn caused stroke-like symptoms, which were in reality a small series of seizures. Yeah, electrolyte imbalances are no joke, and sodium levels, potassium levels, calcium levels all need to be kept in homeostasis by your body's organs in order for you to stay alive. Any disorder that whether makes those levels go up or down can have life or death consequences. Can you imagine? Potassium can kill. Makes you think about eating bananas? Just kidding. You can eat bananas and nothing bad will happen, because your own body's organs will decide how much potassium to take in, how much to let out, so on and so forth. Went to my family doc with the worst headache of my entire life. She dismissed it, telling me it was a tension headache and that I should take a Tylenol and lay in a dark room. First of all, when a patient says I have the worst headache of my life, you don't even think as a family medicine doctor. You say, are you certain of this? You clarify, quantify, ask some questions, and you send them to the ER. Because the worst headache of my life, that specific explanation was also known as a thunderclap headache, is something that needs to be checked with a CAT scan right now, because we're looking for bleeding. Over the course of the next month, I saw her a total 13 times, each time with worsening symptoms. First it was dizziness, then vomiting, then eventually I could no longer see out of my right eye. Every time she told me it was a tension headache or a weird migraine, gave me a prescription for painkillers and sent me on my way. The final straw was when I could no longer walk properly. I would try and take a step, but all I could manage was this weird shuffle. She reluctantly agreed to send me to a neurologist. The next day I showed up in his office and was there for less than a minute. He took one look in my eyes and immediately called an ambulance. Turns out I had hydrocephalus. My ventricles were 5 times the size they were supposed to be, and my brain was literally being squeezed out of my head. Go figure. Hydrocephalus is a really scary condition because that increases pressure, and the ventricles, which are the spaces within your brain, actually start swelling from increased fluid and actually start pushing the brain and increasing pressure on it, which can cause your brain to herniate out of the brainstem. Oh my God, that's just an awful condition. It can result in death. I'm an emergency medicine doc in the Midwest USA. The patient was transferred from rural nowhere to our tertiary care facility, big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest x-ray on the right side, diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better and wanted to send him to us. Sure, send away. An hour later, the gentleman arrives, looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The x-ray finding was his entire right chest was full of blood. We put a tube in it, gave him some blood, and he had to go for surgery to fix the bleeding. Lesson, look at your patient. This is why one of the biggest lessons that I learned working in a level 1 trauma center as a medical student is the first thing you do in an emergency in a trauma situation, inspect the entirety of the patient, especially when a patient is unconscious. Because when they're unconscious, they can't tell you that they have a stab wound in their back. But unless you check that, you won't know why a patient is in shock. Experience while doing residency in China. Kid came in via reference from his village doctor. He had a few random episodes of seizures. Well, guess what? Imaging at our hospital showed that there were a few multiple larva cysts in his head. Yep, kid loved to go to the rivers and put frogs in his mouth. He wouldn't eat them, but he would just lick them. Don't ask me why. Not gonna lie, I probably would not think about larva and frog licking as part of my history taking here in New York City. Maybe there's more that I need to learn. You gotta check out my other 2 Reddit episodes right here, or if you want me to compare what it's like to be a real doctor versus TV doctor, click here, and I'll see you in one of these videos. Which one's it gonna be?